everyone, and welcome to the second in the six-part series on prenatal-to-five fiscal strategies. Just a quick reminder, and this is actually part of our approach, that we do want you to be able to mute and unmute yourself, but then we are putting muting in your control for the most part. If we see that you're having a little trouble, we may go ahead and mute you, but for the most part, we're putting it in your hands to keep yourself muted until you're looking to share. We're just going to give it 1 second for everyone to get on audio, and then I'm going to go ahead and start. All right, thanks again for joining us this afternoon, or depending on where you are in the country, it might still be morning for a few of you. This is the second in a six-part series of webinars being hosted by the Prenatal-to-Five Fiscal Strategies Initiative.
No, you've brought too much stuff out already.
My name is Gina Capito, and I'm joined today by Simon Workman, as well as Jessica Rodriguez-Duggan, who is also part of the team. And then we have special guest state speaker Safiyah Jackson joining us from North Carolina, and you'll hear a lot more from Safiyah here in a little while in the event. We are, just as a quick reminder, we are doing 6 different webinars over the course of what was the second week in January into the end of March. And with the first webinar, we really sort of introduced the comprehensive frame and that approach to dealing with some of the entrenched issues that we have around fiscal strategies for early care and education. And with this next event, or this webinar that you're at right now, we're really going to go deeper into fiscal strategies, and it's really in more than one part, starting now today with mapping and modeling. And then you can see from the slide there, as far as the additional events in the webinar series, that we're going to continue this approach where we're going deeper into concepts that are part of that broader comprehensive approach to fiscal strategies. So we are not covering all of fiscal strategies today, but we are focusing on mapping and modeling. And part 2, which is on February 10th, is going to focus on really understanding how you're using the current pie, or kind of the current set of funds that you have, and then also on revenue generation strategies to grow the pie and grow your funds. So in light of that, I want to share with you our agenda for this afternoon. Obviously, we're doing welcome and introductions right now at the outset. We're going to start then talking about the why and what of fiscal mapping and analysis concept, and then we're going to move into more work on fiscal modeling as another strategy to do this work. And then we're going to unpack more details of fiscal modeling with a case study example from North Carolina. And as I mentioned, we're thrilled to have Safiyah Jackson joining us as one of the leaders in North Carolina that's been active in that work. Just as a quick reminder, we are, again, bringing to you as part of this series and as part of all of the resources for the Prenatal-to-Five Fiscal Strategies Initiative, really a comprehensive frame to dealing with some of these entrenched issues around things like siloed funding streams for children from birth to 5, not funding that is not sustainable and is not maybe being renewed, and a historic underfunding and lack of understanding of what this work actually costs to do, whether that's the direct services delivered to children and families, or whether it's the supports and the infrastructure, the governance for the system. How equity is a part of those elements is also a considerable piece that is a gap in how the systems have been built, and really in some ways reinforces some of those silos and barriers that how we are currently funded and what we currently have access to is used for children and families. So we are putting forward, and just wanted a quick reminder of this idea of the comprehensive frame. And then what we're going to be doing this afternoon is really going deep into one of the areas of the blue cogs. And so what we're going to focus most of our time on during this discussion is the fiscal cog, and we're going to focus really on the first 2 to 3 bullets. As I already mentioned, we're going to start with mapping. We're going to move into talking about modeling, but because we are approaching this from that comprehensive lens, we are also talking about the idea of how answers to questions that you do mapping and modeling for support you in analysis and really thinking about what are your next steps and how are you going to take action on some of the change that you may need within your system to achieve the outcomes that you're trying to achieve for children and families. So we really do hang on to that big thinking about what your vision is for children and families through that comprehensive approach, and how these activities in the cogs are really strategies or steps that are moving you towards a comprehensive approach that supports you in achieving your vision, that's a piece of that sort of pie as you pull it all together. So we want to start today with, as I mentioned at the outset, that we are hoping for engagement with you both in the chat and even verbally as well. So you have the opportunity to unmute yourself at any time and share. And we're going to start out here with some reflective questions to kind of think about this idea of how you've used or what sorts of questions you've had to explore in order to do good fiscal analysis. And so looking at this list of questions, these are, when we think about mapping and modeling in particular, here's some of the questions that those strategies and activities can help you answer within the work that you're doing with your states and communities. And what I'd like you to do is, taking a look at this list, think about which one of these questions you most need the answer to, sort of what is most pressing for the work that you're engaged in or that you're hoping to become engaged in. And what we'd like, and this goes back to that idea of engaging and kind of talking back and forth, we'd like folks to share a little bit in the chat. If you'd like to come off mute and share with us the question that you sort of feel is the most pressing for you to be able to answer, we welcome that as well. We can have a little bit of dialogue around that. We just want you to begin reflecting a little bit on how the answers to these questions would support you in the next steps of your work. So I'm going to pause for a second, see if there's any responses in the chat, and then think a little bit about some examples of this at work. So in our last webinar, we heard from New York State, and New York State was sharing with us how they're going to be moving from having done some modeling work and then but now be broadening it out and moving to more of the comprehensive frame. If we sort of think about these questions, I think that part of what the New York State team has found is that they need to really broaden their approach in order to do a better job of answering number one, how are current funding streams aligned with their principles and a vision for the system that they're trying to achieve. So while they may have some of the answers through their modeling tools to things like how much their current services cost and some flexibility of their funding streams, but they might not have the answer to number two, which then again is supporting them that more comprehensive approach. So taking a look at the chat, got lots of responses. Lots of folks are saying 4 and 5 on the ones. So I really appreciate that number 4, Heather called out that true cost is never reflected in our market rate surveys. We're going to touch on that when we talk about modeling, and that's another example of how important it is, and we're going to do a reminder of our principles, that we really have a set of principles driving this work, because we can have answers to questions about cost, but we may not have answers to questions about cost that really embody the principles of ensuring that workforce is compensated fairly and at a level of the type of work we expect from our workforce. And we know that oftentimes market rate does not have those sort of more philosophical judgments around that the workforce is underpaid. So just having a number on what the price of something is does not really link us to that element of what are we trying to achieve for our workforce, and the fact that we want to retain our workforce and we want to continue to grow them and grow their capacity, and that fairly compensating them is a huge piece of that. Number 3, Betty shared that wouldn't a cheat sheet regarding federal funding streams be great? And I think that that is something that actually is not too hard to achieve. So that's something we can talk about. And I think when we talk about mapping, many of you have different mapping tools that you've done where you've mapped federal streams into your state. So don't hesitate to share some of those samples when we get into that next section. But it does sort of allow for a place to start from when you want to understand how are federal funding streams coming into my state and where do I have flexibility in how I use those that may be state driven versus things that come from the feds, and understanding those sort of distinctions. Thanks, everyone, for taking time to share with each other in the chat. Hopefully this opens up a little bit of kind of dialogue across you all, too, to kind of seeing each other where your questions are and what's most pressing for you at this point. As I mentioned, I wanted to make sure that we were also grounded in the principles, and particularly as we think about answering those questions from a fiscal analysis perspective, how we approach answering the questions certainly would vary if we didn't have principles that pointed to the fact that we wanted a system that's fair to providers and that is fairly compensating them, right? We can answer a question about cost or price from one perspective, and it can tell us that, oh, we might not actually be too far off from what the rates pay for childcare. But then if we talk about what the professionals that work in those settings are actually paid, and if we moved them to a living wage and fair compensation for their qualifications, then we generally see a much bigger gap between what subsidy rates pay and what the childcare the amount that they actually need to run the program. So I think that we just wanted a quick reminder of how important the principles are to undergirding this work as we think about how we approach answering really critical questions that we need to drive our decision making. So with that, I want to now have Jessica Rodriguez-Duggan join us, and Jessica is going to start talking to us more about some of the principles bringing to life within fiscal mapping and analysis.
Thank you, Gina. I am glad to be here today with everyone. It's nice to see some familiar faces as most of you introduced yourself in the chat. And what I want to focus today in this process of a comprehensive fiscal analysis is a true comprehensive fiscal mapping and analysis. And it's really important for communities, states to really have a good understanding of the available funding, where that funding is coming from, where it's going, and how it's being used. Oftentimes, we have an uncoordinated, non-functioning system, and it's difficult to know exactly where funds are coming in and where they're going. So it's very important that this process is undertaken in a comprehensive fashion. So I want to start with talking a little bit about what we actually mean by fiscal mapping and analysis. And what I really want to highlight is the comprehensive piece, because we are capturing all the funding streams and the programs in the prenatal-to-five system, along with all the characteristics of that funding, of that program, and really ensuring that we have all the details and all the information needed to look at what's currently in place, what we can do better, and where the gaps in services are. So by fiscal mapping and analysis, we mean identifying and cataloging the available funding sources for programs and services for young children and their families. And we analyze this data to support decisions around leveraging funding, to understand where to focus our efforts to address gaps, and also identify possibilities to increase efficiency in funding administration and implementation. It's also very important through this comprehensive lens to focus on all the funding streams supporting children and families. So that includes your federal funding, such as Early Head Start, your Child Development Block Grant, your state funding, as well as local funding and private funding, and really ensuring that you have a good understanding of all the revenue streams coming in to support your system. And that last bullet really highlights why we're focusing on the comprehensive piece of this analysis. As Gina mentioned in her intro, we oftentimes have done fiscal mapping in our communities or cities or states. Oftentimes it's, we match a number to a program and go from there, but it doesn't really give us that well-rounded view of knowing what the program requirements are, what the limitations are, the eligibility requirements, and it gives us the information needed to make better decisions on where we focus our efforts in either blending funds or seeking additional funds. So it really is an important process to undergo. Next slide, thank you. So when we talk about fiscal mapping and analysis, it's really important to understand that when you start this process, it is a collaborative process, and you have a leadership role that is taken on and really working alongside, right? Because in order to get all this information, as you see on the screen right there, these are the rubric components, right? So we have to get information. These are the most important parts of the rubric components. And we use rubric components as the actual tool that we can create and actually present as as the mapping and analysis, but it's where you're going to get all this information, right? So there has to be strong collaboration, there has to be open communication, and there has to be a way to ensure that you are reaching out to the right people at the organizations, at the program level, as well as the state level, to ensure that you're getting the most accurate representation of the information. So for example, the rubric components of what we mean is highlighting the funding program and primary service. So let's say we're going to do early Head Start funding, right? So that's the name of your program, and then the services that is provided. We also want to include the source of funds. Where does that money come from? The administering entity, who's in charge of executing that grant and executing that program. What the capacity reached is, the eligibility process for families enrolling their children in there. We also like to capture the provider eligibility criteria. We could be teacher credentials that are needed, support workers, just everything that is required from that funding stream. We also like to capture child eligibility criteria and how long that eligibility lasts. We also include if parents are responsible for a co-payment to the program or the service that they're receiving. And then we also capture the payment process and rates, right? Like how often are programs getting paid and by who, and what process they have to undertake to receive those funds. We like to identify rate policies along with program goals, financial requirements, and program requirements. So it really is an in-depth look at that funding stream, at that program and that funding stream. So in the chat, we have included, if you'll see a link to a rubric that we created in LA County. And that was, I believe, 120 pages, and it was a very in-depth compilation of all their funding and all their programs in the the prenatal-to-five space. So it's a great model and a great example to see how comprehensive these can really be. And then the fiscal mapping and analysis program, right? So we've talked a little bit about why we do this and why it's important. But the most important thing is we're gathering information and investigating how funding streams operate in practice. So it's important, again, that we're reaching out to and interviewing the right people at the right organizations to get this information, that we're working together. Developing the common rubric for cross-funding analysis helps us see programs that are community level programs, state level programs, and federal programs. And then generating the individual funding profiles and summary documents. What's great is that you can have this huge catalog of fiscal mapping and information, but the analysis piece is also very important and can be done in a summary fashion, so you can reach out and share with policymakers and individuals that are making decisions for your prenatal-to-five system. And then you can take this information and create specific tools and resources to share findings. So depending on your audience in that moment, what information can you share based on this funding catalog that you have, and really tailor it to meet the needs of that audience that you're trying to reach to, and share the importance of this. And this really speaks to the idea of trying to identify those gaps, ensuring that we are increasing access to the most needy families, to the most comprehensive services, and really building upon that equity need that sometimes these fragmented systems perpetuate. So with that, I think I'm going to pass it back to Gina, who will actually talk about more about the tools specifically.
Yeah, so to Jessica's point, we kind of have the opportunity with mapping for a bit of a continuum. And so I'm just going to share a couple examples of how we have seen presenting mapping data and what you can do with that analysis and synthesis of information. So the first one is a graphic that you've seen before, and I only share it again now just to highlight the idea that you could very easily with this graphic put large numbers next to items. So the federal money that's coming in from the different departments, you can put the kind of summary number next to it. That is a version of a fiscal map right there, right? You're talking about the flow of the funds and you have numbers next to the dollars. That may not tell you as much about some of those really specific details around administering entity, who are the children that it's serving, and then allow you to maybe do more of that analysis or synthesis of, okay, so where should we go next? What should we do next? And so the next particular that sort of speaks to that same idea then is another way to look at all the numbers in one place is the chart that really just without a flow does all of the amounts in one place by the different initiatives that are funded with the sources. It is sliced up by federal, state, and then local in this instance, and I know that it's probably not the largest thing on your screen right now, right? So it's pretty small. It's just designed to be a sample. We're not analyzing the numbers this afternoon, but just to let you know that the green happens to be in this community, all of the different local sources that they were currently using. And in this instance, this really did start to point to the idea that there was a lot of different local funding initiatives in play. And then it really prompted them to look back at what were the different local funding initiatives trying to achieve, what children were they targeted, children and families were they trying to serve, and where were there places where they might be able to do some condensing of those local funding streams to maybe make the administration a little less burdensome on providers. So that is additional questions that Jessica raised around doing a comprehensive approach to your rubric really does allow you to get into the weeds of how you actually are using the funds, not just understanding the pots of money across the different sources. Another example of slicing up the funds itself, good old-fashioned pie chart, you know, nothing groundbreaking here except for the fact that we all appreciate having something this clear that shows proportion of funding and how it's shared across the whole. It's really great for year-over-year comparisons for programs. So we're looking at something that was estimates for FY 19-20 for the particular community that we're looking at. It's really great for certain levels of stakeholders to look at one fiscal year pie chart next to another fiscal year to see growth in certain areas. And it does show that sort of proportion and also still puts percentages on there. So it's not just a visual that you can see that one funder is a lot more piece of the pie. You also have numbers tied to it. Also, in using this, then used a quick chart that shows the dollar amounts too, to give the whole, the overall picture of the dollar amounts. So again, another way to slice up information that you've gathered from doing the mapping and the analysis and determine what your stakeholders need and how you're using it to inform decision-making processes as well. The next couple examples then take us into more of summary tables that you use for more of the really deeper analysis on the qualitative. And so this list of examples of things that are ways that you can summarize the information you gather through that comprehensive mapping process and through all of those rubric categories really help you to begin to think about things like administering entity. Who are the entities in your communities or your states that are administering the funding currently? How are they working together? What sort of contracting approaches do they use? Are there places in that there's variations in contracting, which could then become burdensome to providers? You know, there's a lot of opportunity for those qualitative issues that are also elements of a siloed funding structure, and that by having the more comprehensive answers to those rubric questions, you can slice things up in this way. One of the ones that I really appreciate is number 6, the funding source by program intensity. Really understanding how much of what we fund is maybe on the primary prevention and is very light touch, and is that meeting families' needs, right? That takes us to that next question of how are the children and our families being served and how are their needs being met by what we're funding. And a lot of times we don't go to these additional layers of analysis with our mapping. And when you take that more comprehensive approach to it, you have that data in hand to be able to go to those additional layers of depth. And so then I want to share the one last graphic as far as like ways to think about the information is this gets us to then beginning to think about, okay, we have different funding sources. Some funding sources we have more control over, some we have less control over, and that can be really useful to then informing next steps from a policy perspective. So to really help a community to say which are the funding sources that are the most restrictive and those that I likely have the least control over, how they're administered, who they serve, how long they serve those children and families, and which are the ones that I have more control over. And as far as like organizing efforts, we frequently, especially in this community, if you look at the example, they have a lot that they have control over in the green. I mean, this is a red to green thing. So it's trying to be pretty good, pretty clear and easy to understand as far as where your locus of control is. Start with those areas that you have the most control over to really ensure that they are efficient, that they are organized in a way that is meeting families' needs, and that they're being delivered in a way that is allowing for the maximum impact. I did see a question in the chat on the idea of how long it takes to complete, and if we're continuing to use the map now. So all the samples that I just shared are actually from many different places. So that piece about whether we're still using it, that's really there at the hands of the communities to then continue using it. I can reflect that several of the communities that they're actively updating the numbers and continuing to use it year after year. The process of doing that mapping and really thinking back to the slides that Jessica was walking us through, really outlining that comprehensive approach to the mapping, that process can take, you in theory could do it in like as short as like a month to 2 months. Generally, I would probably say a little bit closer to the 3 to 4 months to also do some of the analysis and the summary tables. And it really is the most contingent upon the scope of where you're trying to do. If you're doing a region and you have sort of all of the answers to the questions and the different funders are part of the effort and are able to share their information, it's a lot about getting the information and how quickly you get it and how much back and forth with the funding source or the administering entity in order to make sure you really understand the answers to the questions. So it is a form of stakeholder engagement. And so there's a lot that then hinges on how quickly you're able to access the information. And if you're talking about doing it at a state level and doing it across multiple communities, then of course you're talking about a bigger scale of project. So it's a little bit contingent on the size of the project, but it's going to take at least a month to 2 months to do a comprehensive catalog of all the funding streams for early care and education and actually engage those stakeholders who are responsible for the funding in the effort, which is a key piece of it as well. Check real quick to make sure there wasn't any other questions in the chat. I'm going to actually turn it to Simon, because Simon's now going to take us into modeling, which is another piece of analysis that answers deeper questions for us.
Thanks, Gina, and hi, everyone. Good afternoon. So, yeah, the second part of the fiscal analysis we're going to talk about this afternoon is fiscal modeling. And, you know, this sort of term, it might go by different terms. You might know this as cost of quality modeling, cost estimation, revenue and expense. We kind of put it all together under this shared heading of fiscal modeling. And you know, the key thing is that you are creating a model that is going to help you estimate the cost of delivering services and services that meet certain standards. And you can define those standards in various different ways. You can be really flexible with the model. You know, when you look at these different terms, a cost of quality model has kind of historically been used to help understand, you know, what it costs, as it says, at different levels of quality, either at a QRIS or, you know, a state pre-K standards or something, which can be then used to set subsidy rates or inform subsidy rate setting or inform tiered reimbursement if you are paying different rates based on quality, or if you are giving financial incentives to programs to help them move up through the quality levels. You know, whereas cost estimation modeling is really talking about, you know, having this model to that's sort of the Excel model, that's having a cost estimation tool, which can be used for cost of quality modeling, but you know, maybe isn't so aligned with a quality frame. And then revenue and expense modeling is kind of just a modification of these, where you actually also add in the revenue component of it. So you can really say, not just what does it cost, if we think back to those questions from early on, it's not just what does it cost, but how sufficient or not is the revenue that you have available. And if you have multiple revenue streams, what does it look like if you put them all together? Does the revenue help you cover the cost? And you know, those of you who have heard me or us speak before will know we talk about this a lot. But you know, one of the key things you do when you talk about fiscal modeling is clarifying the difference between price and cost, right? So that, you know, when we are talking about fiscal modeling can really help you understand what is the cost to provide the services, as opposed to what is the price that's being charged in the market. You know, if we're talking about childcare, or, you know, if you're talking about home visiting or other sort of program services, often it's a matter of how much money do you have to spend? What's the budget for the department? What's the budget for those services? And then you're kind of working your budget based on the amount of money you have. So you're much more price driven rather than saying, okay, let's figure out really what the cost is and let's go from there. Yes, you might have to make some trade-offs, but understanding what the cost is the key point of fiscal modeling. So a lot of this fiscal modeling that has been done to date has been done in the childcare space. So we're really excited that we have this new map to share with you all that is available on our website. That is a map of publicly available fiscal modeling projects across the country. So you look at this map, anywhere in green is a place that has a publicly available fiscal modeling report. The majority of them are childcare focused. That is kind of where a lot of the work in this space has been. And they really vary in type of intensity and what their purpose of the model was for, or what they've been used for. Everything from in DC, they did a model to set rates, and they're the only state in the country so far that sets rates using a cost of quality model. Others have used it much more for advocacy purposes. So if you go to the website, and I know Casey just put in the chat the link to this map is actually clickable. You can click on it and you can see the modeling report from that state. Full caveat, this is a work in progress. It's based on the studies that we know to be available. If you know that your state has done something that's not on here, drop us a note, put it in the chat, send us an email. We want to make this a usable tool for everybody and keep it updated so that these things act as resources for people. I'll also just note these are publicly available ones. Some states and communities might have done a study for internal purposes and it's not publicly available. We've only put on here the ones that are actually published, but do check that out. So as I said, a lot of those to date have been done in the childcare space. What we have done a lot of time focusing on, as you'll see from all the conversations we've been having, this word comprehensive, is really going beyond childcare and saying, if you want to understand the full cost, the full fiscal implications of your system, you need to do modeling of the whole part of your system, not just childcare. It's also got to be the home visiting and parent education part of the system. And then the systems model is needed as well, right? To really understand, okay, what is the cost of all the non-direct service supports that underpin the childcare? So a lot of the childcare modeling is going to tell you what is the per child cost of providing care. It doesn't tell you how many raters you need to support the quality rating improvement system that supports that. What's the cost of the professional development that goes underneath that? The licensors, what is all of those additional costs? And especially when we start talking about our big, bold North Star, right, of saying, this is the comprehensive system we want, that does require administrative support. It does require that sort of state or community level support. And so understanding the cost of those supports is really important. And as we move into the North Carolina example in a little bit, you'll hear a bit more depth about how North Carolina approached this full comprehensive modeling, and especially on the home visiting and parent education model. And Casey just put in the chat a link to our most recent quick take on fiscal modeling, which also talks a little bit about these three different parts. So, again, if we think about the process and the principles, if you think back to what Jessica presented on the fiscal mapping, similar in fiscal modeling, you really have to think about what is the purpose, what are the questions you're trying to answer, and that will help determine the best process for fiscal modeling. There are a lot of different ways you can do this, a lot of different tools. Again, you can check out our website where we have a link to a lot of the different tools that are available. And there are some tools that can help for just advocacy purposes. The Where Does Your Childcare Dollar Go tool really can give you a very high level, what is the monthly cost of childcare that meets licensing standards? You can just run some quick numbers from that and show this is the gap between that and subsidy. On the other hand, if you want to set rates based on this, you need to do a bigger study, right? You need to really gather data. You need to engage a lot more stakeholders. So really understanding, well, what is the questions we're trying to answer? And then let's align the right study and the right process for that, having the right tool for the job at hand. The second big thing is going to be about how you're defining your quality. What are you modeling? Are you modeling licensing standards? Are you modeling QRS standards? Are you modeling the home visiting model like as is, or are you prepared to say, let's change the caseloads in the home visiting model and see what the impact of those costs are? Are you looking at the current system? Are you looking at an aspirational system? Again, common through all this, when you look at that process on the right there in the green, you've got to engage stakeholders. It's really key to make sure that stakeholders are engaged in the process so that you have a model that is reflective of the questions that the stakeholders are trying to answer and that's aligned with principles. Again, back to the beginning conversation around principles, if one of your principles is paying compensation to educators that is fair, that is a living wage, you then need to have a conversation about what is the salary number you're putting in your model. Because if you put in minimum wage in there, then the question is that fair compensation? Does that align with your principles? If you have, if you're modeling out a subsidy system where you only get the incentives when you get to high quality, you have to question who's got the resources to get to high quality, and is there equity of access to get to those resources? So really, thinking about not only the questions you're trying to answer, but how do they fit in with your principles? And so very quickly, I want to just say, what do we mean when we talk about a model? This is kind of an Excel-based model that we developed. I just want to give you kind of very high-level overview just to see, what do we mean when we talk about a model, and how is it a living model that you can kind of ultimately change and play around with? What you can see here is that in this Excel model, you can pick what star level are you at? What region are you in? All of the things in yellow can be changed. And this sort of shows you, so that on this page is where you're kind of saying, this is the profile of my provider, right? And this is the childcare model. They're at this quality level, they're in this region, it's this size program serving this many kids. And then you have, what are the quality additions? Are you doing enhanced ratios this state have? Do you want to pay salaries at a kindergarten parity or at a particular salary scale? All of these inputs then feed into this behind the scenes calculations page that, that sort of does all the calculations for behind you. So the wages that go in here are driven by decisions you made on the first page. The ratios are driven by the decisions you made on the first page. And the revenues are driven by the decisions you make on the first page. If you say 50% of the families pay private tuition, then the model is pulling from there and giving you a per child number based on all of those inputs. And you start to see there that behind all of this are hundreds of lines of data in these tabs. And if you spend the time up front getting good data in there, then there are infinite possibilities of scenarios you can run with this model to answer various different questions with good data coming out. As Ann Mitchell always used to say to me, it's good data in equals good data out. And I think that's a really good thing to sort of remember, that it's worth putting the time in to build the good model with the good data behind it, because then you can really play with it to answer a lot of different questions. And on that theme, if we look on here, this is an example of what you can do with those results, right? So here, the question in this particular community was, are the current revenues sufficient to cover the cost of home-based quality infant care, right? And the decisions about what does quality infant care look like led to a cost model that said the per child annual expense was just over $30,000, which is this orange line here. And then you start laying the potential revenue streams aligned to it, and you see that neither tuition, nor contracts, nor vouchers, whether you take the food program or not, you still don't get anywhere near that $30,000, right? And so this is where you can start to tell that story of, yes, it's great that contracts pay more than the voucher, but you still are not getting there. And if you start and think back to those models, there are so many different scenarios you can run in there. And if you're pulling in the revenue, that then this whole messaging piece of how do you turn this into interesting graphics to tell a story really starts to go back to, are you answering those questions, and are you using these graphics to show whether you are or are not meeting your principles, right? And aligning with the principles, especially when you start doing compare and contrast charts. And so I'm going to pass it to Gina to talk us through a bit how North Carolina has used this modeling process, the modeling process, and talk with Safiyah from North Carolina about this as well.
Thanks, Simon. So one note, I want to do a little bit of introduction before Safiyah and I start talking. We're going to do like a light interview. So we encourage you, if you have questions as we're talking, please put them in the chat, because we'll make sure that if we are not able to answer them during today's webinar, that we can get some answers to you after the fact as well on some of the specifics of the North Carolina example. Wanted to note one thing along the lines with what Simon was sharing around comprehensive modeling. The overall North Carolina process did include comprehensive modeling approach. It included childcare modeling, home visiting and parenting education modeling, and then as well as systems modeling. We are going to focus in this case study really in on the home visiting and parenting education modeling and do a little bit of a deeper dive there. And Safiyah Jackson is one of the directors at the North Carolina Partnership for Children, who has been a state leader in this process in the state of North Carolina, focusing on all of the different aspects. So while we're really just talking about home visiting and parenting ed today, Safiyah's got a wide lens range with the Smart Start Network to the role of direct service modeling, as well as thinking about system and infrastructure costs. So there's a lot that we can engage with her around. And what we thought would be helpful is to sort of tie in some of the things that we've been talking about as kind of core strategies and approaches to the work, and have the North Carolina story sort of fill in some additional color on what that looks like, especially thinking about home visiting and parenting education modeling, because it's the area of modeling that folks are probably would see as the newest to really understanding costs. So continuing in the theme of how important engaging stakeholders are, that's really the first thing that I'm going to ask Safiyah to share with us a little bit more about, is how across the modeling process, North Carolina approached that idea of engaging stakeholders, and how that was sort of a layered approach in that work.
Yes. Hi, Gina. Hi, Simon. Hi, everyone. I'm happy to be here kicking off a conversation that, as Gina said, hopefully will go beyond this webinar as we continue to share different parts of what we've been doing in North Carolina. So as you mentioned, Gina, this work has brought together funding streams across North Carolina to identify some core visions and principles that we want to hold true. So I sit here representing many leaders and funders and advocates in North Carolina. And if you go to the next slide, it will share for the group that when we first started this work, it really started from a landscape study. And I think that that's really important, because the landscape study of an analysis of where home visiting was being implemented across counties really sparked and created a momentum that brought funders together to say, we must come together to do something different about this. Not enough children are benefiting from this intervention. So on the screen here, you see the funders of home visiting and parenting education, advocates, our fearless leader, Kelly Kimple and Cindy Sauter O'Neill. You'll see we had investments and commitments all around, from funders to state, private funders, state funders. And we were just happy to bring all these voices together to really define what do we want for a vision for home visiting and parenting education as a continuum, and the role that fiscal modeling and assessment would play in that role. One more quick thing on that, as we talk about just how important it is to bring voices to the table early. This is just a quick visual that helps you all see that the previous slide was the big bubble here in the middle, this systems planning team. But while that planning team was going on, we had a subcommittee working on fiscal modeling under Gina's leadership, and so excited to have actual model that we can start plugging numbers into. We also had a governance group that was continuing to move things forward. But very important, I'd like to point out, is the Home Visiting Consortium over here to the left. It's a collection of models, home visiting and parenting education models, that we often turn to for input throughout the development of the plan. So we really tried to bring together all of the stakeholders to really come together and define what we want for the system, and how our fiscal strategies and administration could be improved to advance that model, the model and vision that we want. So, okay.
There's one on family engagement, right? Because that parent and family voice was
Yes, yes. But I want to just stop here for on the slide. Go ahead, Gina.
No.
If you go to the next slide, I did. This is just recalling back the fact that we, as we were building our system, we wanted to make sure that all children were accounted for and that we built in very explicit efforts towards racial equity. And one of the ways that we did that was, again, starting with who's at the table. And that's on the next slide, Gina. On this slide here, you'll see how we engaged in a multi-pronged process. It kind of comes together nicely on this slideshow, but we worked with our partners here in North Carolina with the division and some preschool development dollars and the North Carolina Early Childhood Foundation as they were going out collecting and input and hearing from parents and families. We were able to work with them so that we could add questions and also, more importantly, use all of the input back that they were hearing. So on the right-hand side, you'll see some of the additional voices that were part of the conversation. And you'll see 600 families across 15 counties were engaged in discussions in a variety of focus groups, interviews, and surveys. And we intentionally, as a planning team, we took a pause from our planning and we turned to the data that our colleagues were providing as input to really crosswalk and make sure that what we were hearing from families were explicitly showing up in the plan that we were developing.
Safiyah, do you want to move now, thinking about those principles and that idea of being inclusive of all families, about building things that would be fair to providers and the types of supports in developing their capacity? I want to talk a little bit about then some of the components of the model, how the model embodies those principles that you just shared.
Yes, yes. First, I want to just put in the chat here a link to our state system plan in North Carolina for those that are interested in the goals and objectives that we identified for the fiscal modeling or fiscal funding aspect. You'll see in that plan that we have very explicitly connected a set of equity values to the governance of this work. So very important upfront, really defining what do we mean by equity, how is it explicitly woven into the initiative, and how do those values and policies directly relate to the administration of dollars. And we have a very, you'll see a goal that says we want to develop and implement a plan that specifically targets and addresses and distributes resources to identify inequities. The model will help us do that because it is helping us to now look at where are not only programs being implemented, but how are they funded, in what way. And as we move toward ensuring that there is a multiple module, a continuum of resources for families on the home visiting and parenting education spectrum, we really want to make sure that we're taking that fiscal modeling and transferring it into community TA. And that's really where the rubber meets the road. We'll be able to take the model, target specific counties, work with funders and agencies in the county to provide real targeted community assessment and development and coordination. And we believe that that's really critical to the fiscal modeling. We have goals. We're hoping to reach 1,000 more families by really moving from community fiscal modeling and community assessment to actually expanding the services provided in a county. And I see a question in light of the new federal program. Okay, I see a question in the chat here.
So Salma's question was about, in light of the new federally proposed changes in wage requirements, and this actually is something that across modeling in many of your states has, I'm sure you've experienced already with minimum wage ordinances that are generally far higher than the federal minimum wage. And so we we build that in. We build in sort of all the regulations and the idea that if minimum wage is going up, then what are the requirements for positions that are not earning minimum wage to be raised to proportion higher than the minimum wage. So by having this tool, North Carolina can make those modifications as these sorts of changes come out. This is, as Simon mentioned, this is sort of a living, breathing tool for them. It's not a point in time that they're just running related to what it costs to run the programs. They can continue to modify and see the impact of it even before it becomes a regulation too.
And we have a number of counties, fortunately, in North Carolina that are leading the way on minimum wage. So having a model that is flexible will allow us to have those county specific. So while we're waiting on, federal changes, we can have the flexibility locally to do assessment planning that really helps to expand resources within a community. Cool. It's been really exciting to be in conversation with other funders and to feel like the silos and the own data that we have for our own funding and assessment data that we're at the table, share with very open, trusting relationships, sharing what our expenses and costs and how we approach what our administration guidelines are of funding. And one thing that is really exciting and that we hear from our local counties is, please, state folks, align what you're doing, align the administration of these dollars so that it makes it easier for us on a local level. And those are the kinds of parallel conversations that we're having while we're using a fiscal modeling tool and very targeted community technical assistance for assessment and planning, that we're also taking a look at how we as funders are looking at the full picture, the spectrum, the continuum, and going beyond our individual targeted priorities. Within the Smart Start Network, we fund quite a bit of models. There are upwards of 17 models of home visiting and parenting education in the state. So it's not a small task, but it's been exciting to have so much momentum. Oh, I was like, what is that on the screen? Awesome. All right. So we are really excited to be partnering with our Division for Child Development and Early Education on the expansion of a universal home visiting and piloting it in certain communities. And by way of that universal home visiting model, it's allowing us to really practice, test what it looks like to really engage all models in expanding coverage in a particular county. The inputs and in the particular model that Gina and team that we've developed, it accounts for all of those 17 models. And it allows us to really look at how many children are being served and really set some targets. And this is, it's a level of assessment and planning that we would not be able to do without a model that all of the funders actually agree to.
And that probably speaks a little bit to Heather's question, just quickly, that one that popped in the chat there, Safiyah, is this idea of some of the challenges of working across. I think that Safiyah has done such a nice job of laying out that set of principles and things that the visioning of the home visiting and parenting education was set for. And that was sort of critical to those challenges of the idea that we weren't building a budgeting tool for McVie funding alone. We weren't building a budgeting tool for the State Department that funds most of the parenting education. What we were building is a tool that showed everybody together. And there had to be consensus around a shared vision for what was trying to be achieved for home visiting and parenting ed outside of a model in order for the model to have that sort of principle as its base. And so that, not to say that there weren't any challenges, getting access to information is going to be a theme for the whole webinar. That's always one of the biggest challenges, but folks had to share that vision of what they were trying to achieve to start with to even go into a model like this.
Exactly, that's right. And looking at Heather and Molly's question, thank you for those. It's why I start with the state-funded landscape analysis, because it was really a call to action. I'm a recent transplant from Illinois to North Carolina just over about 2 years ago. And when I arrived, the landscape report had already been released and already been promoted. And it was a really unifying seminal piece of information and report. So honestly, we actually have not experienced many challenges to date that I can really lift up and share. The fact that we were all together presenting the landscape, all together figuring out what to do and agreeing that there needed to be some statewide plan. I would say we had a lot of fun really putting the plan together. You know, after saying that, I would say probably the biggest challenge we had was in defining equity and the role that it would have. Because in a state like North Carolina, there are clearly racial equity goals that need to be set, but also economic equity goals that often comes as part of the conversation. But through conversation at that point, we had already developed a trusting space to have those conversations. And I'm really proud of where we landed in the end.
Safiyah, do you want to speak a little bit more about some of the next steps? I know you mentioned the community-based technical assistance, but sort of what's next in the last couple minutes that we have would be great.
Yes. Thank you. So we first have to start socializing and sharing the tool, which we've already started doing that. So broadening the understanding and use of the tool is clearly a very important next step. As Gina explained, we have established a certain base for certain expenses within the model. So we really just need to start to be able to start testing it. And it's through the community technical assistance that we will start testing in a very focused way. The tool will be there for our funders and others to use and start testing as they're learning about the opportunity. But I really see it directly tied to the community TA in a way for us to really document, like, what does it look like to go into a community, into a particular county, partner with those stakeholders to say, what do you want to see happen for home visiting and parenting education? What goals do you have for your county? And how can our technical assistance and this tool help you to be able to plan and assess that? So I know I spent a lot of time talking about the local community and implementation. It's probably because at the state level, our partners have been working so closely together to maintain a whole picture view, to ensure that we're all moving in the same direction as stated here. Now it's time to really bring along our local community implementers so that there is alignment and that our visions really come to life.
Mm-hmm. And I think that last point that you have there on the screen really demonstrates that the state relies on the good community understanding of their need and saying to the state, here's what we need in our community. And that's a dynamic that North Carolina has really established, and having a tool that is able to be used at both levels supports that sort of planning to really carry it forward. And I think that's a great value to hold as well.
Yeah. And
so we are...
I just want to say that the link to the plan that I put in the chat, we're having our first governance meeting on in March. So we're literally in a transition from planning to early stage implementation with a lot of good projects happening. So happy to be here and answer questions later.
Thank you so much, Safiyah, for whetting everyone's appetite on how not just to have a model, but then what are you doing with it and how do you have it carry you forward. I just want to take in the last few seconds that we have just a quick reminder of where the resources are. If you didn't see that in the chat, that they're on the prenatal-to-five fiscal.org website. All as usual, the webinar recording as well as the slides will be available tomorrow and sent out to everyone that registered. So if you have colleagues that registered that weren't able to join, they'll get access to the materials as well. And then we're going to go deeper into fiscal analysis, thinking about revenue generation and innovative strategies for supporting programs on the February 10th event. And then later events, we are going to talk more about the system side and governance side, to Safiyah's point about like what's next in North Carolina. So continue to hang with us for the series because we're really unpacking all these concepts across all the points of contact. Thank you all for joining us this afternoon and for your rich discussion in the chat. We look forward to seeing you in early February.